It's a beautiful day. You're most welcome back to Sydney Medicals. Today we are going to be talking about cervical cancer. So what is cervical cancer? Who is at risk of getting cervical cancer? Can cervical cancer kill? How do you protect yourself from cervical cancer? I'll be back to answer this in a jiffy. Stay tuned. Welcome back to Sydney Medical. So cervical cancer refers to abnormal growth of cells that occurs within your cervix. Now, just like any other cancer, cervical cancer is dangerous and it can kill. It can also metastasize, meaning it can move from the cervix to other parts of the body, especially to the lungs, and result into serious cough and, of course, lung cancer as well, since it can spread. Now, cervical cancer is usually linked with a virus known as the human papilloma virus, which increases your chances of getting cancer of the cervix. This virus is sexually transmitted. It is known to be the most common sexually transmitted virus. Up to 98% of those who have ever had sexual intercourse have the virus. What does it mean? That if you are not a virgin, your chances are 98% that you already have the virus. However, there are a number of strains which a lady should have in order to be prone to getting cancer of the cervix. For this reason, having multiple sexual partners increases your chances of getting cancer of the cervix. Why? Because different strains can be in the body of different male partners. How about in males? Well, in males, it is linked to cancer of the penis. However, penile cancer is extremely rare. So in most cases, the virus is usually harmless in males. And then in females, if you have all the strains, which are 3 different types of strains required for you to get the cancer of the cervix, not necessarily that you'll get the cancer, but you'll be at high risk of getting the cancer of the cervix. So what is the most common sign of cancer of the cervix? Usually, you'll get painless bleeding after sexual intercourse with your partner. It is rarely painful. In most cases, they are painless. And then you begin to sometimes get very little periods, maybe a drop or two, and the period just stops like that because the lesions has blocked most of the opening of the cervix. So you tend to get little bleeding. At times, it can also cause general body weakness. You feel there's that general body weakness, sensation of a mass in your pelvis, especially if the lesion has started growing. Bleeding. Usually these people easily bleed. Whenever they get any slight touch on the cervix, they'll end up bleeding. So always the best how to know is, of course, having a cervical cancer screening. It's advisable for those who are HIV negative to have at least a screening once every 3 years, the moment you have reached 24 years of age. And for those who have not yet reached 24 years of age, you should screen yourself only when deemed necessary by a healthcare professional, or if you could be having some doubts that you may be probably having cervical cancer. The reason why you begin screening at 24 years of age is because after childbirth, probably you will have your first child, or in most cases you may not, but you will have at least some multiple sexual partners, which may be increasing your chances of getting the infection. Not necessarily the infection with the human papilloma virus, which in turn increases your chances of getting cancer of the cervix. Let's remember that cancer are abnormal growth of cells that usually do not perform their functions as need be, and they multiply abnormally. For this reason, they can affect essential functioning and physiological processes in the body. So, still, how do you protect yourself? I've already talked about. Have routine screening. For those who are HIV positive, you have to screen yourself once every year, or when deemed necessary by your healthcare professional, but at least once every year. Those who are having HIV are at higher risk of getting the cancer. Unfortunately, that's the fact. You'll be at high risk of getting the cancer because your immune system is suppressed and your cells can easily go out of control and multiply abnormally. And then those who have had many number of children without spacing, in a spacing of, let me say, less than 1.5 years, the continuous opening and closing of the cervix stretch the smooth muscles of the cervix, of course, together with the cells that line up or make up the cervix, which would in turn put you at a slightly higher chance of getting the cancer of the cervix as compared to those who are not having many children or who are spacing their children properly. So some of the risk factors of cancers are also still there, aside from the human papillomavirus. Always ensure that you check with your healthcare provider for any abnormality you feel within your pelvic region or in your reproductive tract. Regardless, let's continue with how to protect ourselves from cancer of the cervix. Eat properly. There are anti-cancerous foods that you can eat. Foods like tomatoes, most of the, let me say, fruits are cancer protective. Also consider eating vegetables. These are all cancer protective foods. And then you would be good to go. Remember, it's about consistency, not quantity. So if you can take at least a tomato per day rather than taking 5 in a day, it would be much more effective in protecting you from cancer of the cervix. Also, reduce on the number of the sexual partners that you have, because the more, the higher your risk of getting the cancer of the cervix. Consider vaccinating your children against cancer of the cervix. The human papillomavirus vaccine is usually given at about the age of 10 years old. So ensure that your girl child get this vaccine to protect them from cancer of the cervix. Then the rest, of course, you leave it to God. Then you'll be protected from this cancer. Is cancer of the cervix deadly? Can it kill? Yes, cancer of the cervix can kill if at all it is not treated. This cancer is treatable and someone can completely cure from it if arrested at an early stage. How early? Well, if it's still in stage 1A or B, that is still situated within the cervix only, we have a treatment called cryotherapy, whereby these cancerous lesions are destroyed with radiations and you completely recover from it. Okay? If you have anyone suspected to be having cancer of the cervix, having bleeding after sexual intercourse, consider contacting us immediately so that we get them treated. Furthermore, also, if you have cancer of the cervix and it has already gone beyond the cervix, as I told you, it can spread, still we can do what we call hysterectomy, that is removal of the cervix together with your uterus where it has probably spread, and then you lose having a child. You lose your uterus. Of course, you won't be able to have a child in future, but the cancer lesion, you'll recover from it. You'll still be just good to go. Furthermore, you should also consider contacting your healthcare provider as soon as possible if you want to recover from this cancer. However, the disadvantage is it can spread. Medically, we call it metastasizing. It can spread to other parts of the body. Most commonly with the cancer of the cervix, it can spread to the lungs and result into lung cancer. Then usually it gets too late. So this is the brief information I want to give you about cancer of the cervix. For someone who asked me, tell us about cancer of the cervix. That is it about cancer of the cervix. So always stay tuned and know that cancer of the cervix, if arrested early, if diagnosed early, you can fully recover from it. From Sydney Medicals, I wish you good health.